Hello everyone and welcome back to my channel. So this was a 62-year-old man who was missing from his home for quite some time now, and therefore the wife lodged a complaint and the police finally recovered him from a roadside. On questioning him, he was quite confused and he couldn't reply to most of the questions. He fumbled. He was using repetitive and wrong words sometimes, indicating that there was some kind of cognitive impairment. So the wife finally took him to a specialist doctor and she gave the history that the man was actually having difficulty in speech and understanding and judgment and language and actions for quite a few years now, and he has trouble remembering so many things. Indeed, there was a memory loss. Yes, what you are guessing is absolutely right. This is a case of Alzheimer's disease, and today I'm going to take you through the pathogenesis and the important details that you need to know regarding this very important topic, which is a long question for all categories of students. So let's dive straight into Robbins. So Alzheimer's disease is the most common cause of dementia in the older adults. So only in the older adults after the age of 50 this disease manifests. There is impairment of higher cognitive functions, there is deficits in memory, visual spatial orientation is lost, and judgment, personality, language all are defective. The patient ultimately, the affected individual ultimately becomes profoundly disabled, mute and immobile. Now, coming to the pathogenesis, this is a very important question and we need to understand this. I'm going to explain you this image first. So you can see that this is the normal protein. Okay, what you have a beta secretase, alpha secretase and a gamma secretase. These are the sites of cleavage. So what basically happens is this is a normal protein, a normal amyloid precursor protein, and this is one pathway and this is one pathway. So this pathway is normal, means if this amyloid precursor protein is getting cleaved by alpha secretase and gamma secretase, then what is formed here is normal and there is no formation of A beta monomer. So the main pathogenesis lies in the formation of A beta monomers or A beta plaques and tangles. So you can see here that the role of A beta generation as a critical step for initiation for Alzheimer's disease pathogenesis. So basically, the role of A beta generation is the first step and the most important step in the pathogenesis. I will come to the details, but first let me explain this, that whenever the amyloid precursor protein is getting cleaved by beta secretase and gamma secretase, then you can see that there is formation of A beta peptide. So if it is being cleaved over here and here, there is no formation of A beta. But here you can see that the A beta peptide is remaining, and this is what is the A beta monomer, and this happens when the cleavage is being done by beta secretase and gamma secretase. Here it was alpha secretase and gamma secretase, but here it is beta and gamma. So very important, beta gamma secretase cleavage is the initial step that leads to formation of A beta monomer, from there A beta oligomer, and then it aggregates to form amyloid fibrils, which ultimately form plaques and tangles. And now you can see that these oligomers will ultimately cause kinase activation, tau phosphorylation, microtubule disassemblies, synaptic disjunction, cell death, and other pathways which cause the neuronal damage. There is aggregation of tau proteins which ultimately lead to formation of these plaques and tangles. So important thing to understand here is that plaques and tangles is having amyloid fibrils which are made of A beta oligomers, and it also has this tau aggregation. So plaques and tangles have tau as well as A beta peptide. So this is how basically it is forming. This is a very simple, you just need to remember this important point. But let me now take you through the entire process. So the fundamental is the accumulation of two proteins, A beta and tau. Just now I told you that there's accumulation of A beta here and also tau, right? A beta, right? A beta, you can see here that A beta is also there and tau is also there, so both are important and that forms plaques and tangles. So So there is accumulation of two proteins A, beta and tau in specific brain regions, likely as a result of excessive production and defective removal. So basically what happens is the pathological hallmarks is that there is amyloid plaques and neurofibrillary tangles. Okay, so these two are very important points. There is deposition of amyloid plaques and neurofibrillary tangles. So here you can see, I will just take you to the morphology and show you that there is a plaques formation and also neurofibrillary tangles production. Okay, so the brain is having cortical atrophy marked by gyral narrowing and sulcal widening that is more pronounced in the frontal, temporal and parietal lobes, and there's compensatory ventricular enlargement on the other side. Structures of the medial temporal lobe, including the hippocampus, entorhinal cortex, and amygdala, are involved in the early stages and they are atrophied in the later stages. The major microscopic abnormalities, as you can see, are the neuritic plaques and the neurofibrillary tangles. There is progression, eventually severe neuronal loss and reactive gliosis. Now, what are these plaques? These are focal spherical collections of dilated tortuous axonal and dendritic processes around a central amyloid core. So if I can just take you here and show you what are neuritic plaques, basically they have a central amyloid core, and surrounding that you can find that these are the dendritic processes which contain the tau aggregates, and these are the neurofibrillary tangles. So there is a central amyloid core surrounding which there may be a clear halo. These neuritic plaques are the dendritic processes around the central amyloid core, and this entire thing is a plaque, and they may be surrounded by a clear halo. And these tau aggregates are biochemically similar to neurofibrillary tangles. So if I can just show you that you have this accumulation of A, beta and tau, right? A beta will have this amyloid plaques. So amyloid plaques has the composition of A beta peptides, and the neurofibrillary tangles will have the composition of the tau protein, right? And very important, A beta is the initial step for development of the Alzheimer's disease, and later on the tau protein will also get deposited. As you can see here, this entire process I've shown where the A beta is was the initial step. After that, you will see that the tau proteins will also come into play. Now, these plaques are found in the hippocampus, amygdala, and neocortex. The amyloid core can be stained by Congo red. The dominant component of amyloid plaque core is A beta, a peptide derived by proteolytic cleavage of APP. Very important point. I've already mentioned this previously, so I'm not explaining this again. Now, sometimes what happens is that sometimes there's formation of diffuse plaques. Now, what are diffuse plaques? They are deposition of A beta peptides in the absence of the surrounding dystrophic neurites. So, it is just a deposition of A beta peptides and there is no dystrophic neurites surrounding it. Okay, these are there in places like basal ganglia and cerebellar cortex. Now, these neuritic plaques, this is a very important point to understand. This neuritic plaques, this is one. Neuritic plaques is something that we generally happen. Along with that, we also have diffuse plaques, right? Now, neuritic plaques will have A beta 40 and A beta 42 both, okay? But diffuse plaques will only have A beta 42, right? So you can see I have mentioned here that the neuritic plaque is something which is mainly found, right? And there we have A beta 40 and A beta 42 both. But diffuse plaque may you only have A beta 42 and not A beta 40. So coming to the remaining points, as I mentioned, we are done with the first point. Now coming to the second point, which is the neurofibrillary tangles. These are tau containing bundles of filaments in the cytoplasm of the neurons. Very important, you know, they have this kind of flame kind of a shape, and sometimes they also have a round contour which is called as the globose tangles. These tangles are visible as a basophilic fibrillary structures but are demonstrated much more clearly by the silver stain. Now, these tangles sometimes they're insoluble and they are resistant, and therefore in some of the sections you can find these as host or tombstone appearance. They are composed of unpaired helical filaments along with some straight filaments that appear to have similar composition. Aggregated tau is also present in the dystrophic neurites that form the outer portions of the neuritic plaques and in axon, coursing through the affected gray matter as neuropil threads. So all this morphology you have to write in your exam if question comes on this topic. Okay. So you need not mention all these points, only the ones I've highlighted, only the points that I'm explaining, you can just mention those points. There's another finding, that is cerebral amyloid angiopathy. What is this? This is an accompaniment. This sometimes is present along with Alzheimer's disease. Now, what is the difference in contrast to the amyloid, which is deposited in the neuritic and diffuse plaques, which is mainly composed of A beta 42? The amyloid in this is predominantly composed of A beta 40, right? So, as I mentioned previously, that in the cerebral amyloid angiopathy, you're only going to find A beta 40 composition of the amyloid, while the amyloid which was deposited in the neuritic and the diffuse plaques, there the A beta 42 was also there, right? But here only A beta 40 will be present. Okay, so this is the morphology. I will just take a moment to show you this image. Here you can see that these are the plaques, okay, with dystrophic neurites surrounding the amyloid cores. So you can see these are the plaques, okay, and these are the neurites which are surrounding this amyloid core. Okay, now this next point that you can see is the plaque core and the surrounding neuropil. Okay, this is the one that you can see here. Now and you can see that these are immunoreactive for A beta. Okay, now this is the third image where you can see these neurofibrillary tangles present, Hannah. You can see these tangles are present. These are the neurofibrillary tangles. Okay, and this one shows the silver stain. You can see how nicely it is being highlighted. The neurofibrillary tangles are highlighted in black, so how nicely it can be seen here in the silver stain. Okay, so this was the point that I was mentioning. So we have already done with the morphology, because I wanted to make sure that you understand this difference in the amyloid plaques and the neurofibrillary tangles. These both are coming under the morphological points. Now, what are plaques? Plaques are deposits of aggregated A beta peptides in the neuropil, while tangles are aggregates of the microtubule binding protein tau. Okay, so this is the point which I mentioned earlier, that amyloid plaques is the A beta and neurofibrillary tangles is the tau protein, okay, which develop intracellularly and then persist extracellularly after neuronal death. Fine. So A beta generation is the critical initiating event for the development of this disease. Now, these points you must remember: the role of A beta, the role of tau, how these things are forming, the other genetic risk factors, the role of inflammation, and the basis for cognitive impairment. This is a very important point. I'm just coming backwards because these points are less important. So, role of inflammation may A beta, the protein which is deposited, is eliciting an immune response, an inflammatory response in the microglia and the astrocytes, and this is how this inflammation will cause alteration in the tau phosphorylation, oxidative injury to the neurons, and this aberrant pruning of synapses. This is how they will cause the clinical features. Now, why there is a cognitive impairment? You can see here that this large burden of these plaques and tangles is associated with severe cognitive dysfunction. And this point is an MCQ point, a very important MCQ point, that the number of neurofibrillary tangles correlate better with the degree of dementia than does the number of neuritic plaques. So it is the number that is important first of all, and the number of this tau protein. So neurofibrillary tangles was the tau protein, right? I've already shown you here that the tau proteins are the neurofibrillary tangles. So you must understand that the neurofibrillary tangles, that will correlate better with the degree of dementia than the neuritic plaques, because you know that the neuritic plaques or the amyloid plaques are the A beta. So the degree of dementia is determined by the tau proteins and not the A beta proteins. Okay, comparatively, the degree of dementia is determined by the tau proteins of the neurofibrillary tangles. That is more important rather than the A beta peptide or the amyloid plaques. Okay, why I'm mentioning here is that you must remember this point, that these two words are interconnected and these two words are interconnected. This is the basis, and this is something which is more correlated with the degree of dementia. Okay, so I've already mentioned, it's already being mentioned here. This is, I will take a moment to write this down. Neurofibrillary tangles. the tau, okay, and the amyloid or the neuritic plaques are the A beta peptide. So now when you see this point, you understand that the number of these tangles or the tau protein will correlate better with the degree of dementia than the number of the plaques which is present. So this is an important MCQ point. I just wanted to highlight this point here. Now, biochemical markers have been correlated with the degree of dementia. Loss of choline acetyltransferase, loss of synaptophysin, immunoreactivity, and amyloid burden. If we talk about the biomarkers, that the A beta deposition is demonstrated by the imaging methods that rely on the 18F labeled amyloid binding compounds, and this approach can identify the asymptomatic patients. Additional evidence of neuronal degeneration associated with AD related pathologic process includes presence of increased phosphorylated tau and reduced A beta in the CSF. So what do we get in the CSF? We get an increased tau protein and a reduced A beta. Okay, this part I already went through, and now I'm going to come back to this point and talk about the genetic factors. So what are the important points? You have this the gene on chromosome number 19 that encodes the ApoE or apolipoprotein E. There are three alleles, E2, E3, and E4, and the dose of E4 allele increases the risk of Alzheimer's disease and lowers the age of the onset. So very, very important point. The ApoE isoform promotes A beta generation and deposition, but also appears to exacerbate the A beta dependent tau mediated neurodegeneration. So you must understand that the dose of E4 allele is correlated with the risk of Alzheimer's disease. The gene encoding this APP or amyloid precursor protein is on chromosome number 21. This is something which is present in the Down's syndrome, and therefore you find in the Down's patient you also have this cognitive impairment, right? So here it is clearly mentioned that amyloid precursor protein, I'm just going to highlight this, that amyloid precursor protein cleavage by alpha secretase and gamma secretase produces a harmless soluble peptide. So alpha and gamma will produce a harmless peptide, whereas this cleavage by beta and gamma releases A beta peptide, which form pathogenic aggregates and contribute to characteristic plaques and tangles of Alzheimer's disease. So it is the beta and the gamma which, when causing cleavage, will ultimately give rise to these plaques and tangles. The clinical features will include language deficit, loss of mathematical skill, loss of learned motor skills, become incontinent, mute, unable to walk, intercurrent disease, often pneumonia. So I'll just take you to my notes and talk about the same points, just reinforcing the points that is the most common cause of dementia in the older adults. There's difficulty in speech, use wrong words, trouble remembering the names, and they have difficulty in naming picture objects called as anomia, and there's difficulty in judgment, personality, language is affected. The patient ultimately becomes disabled, mute, immobile. This is basically a neurodegenerative disease. There is progressive loss of neurons due to accumulation of protein aggregates, and all these points I've already mentioned. These are the genes I've already mentioned about this. So in the CSF you find that the tau protein is increased and the A beta is reduced, and treatment basically involves the clearing of the A beta through immunological approaches, because that is the main culprit. When the A beta is deposited continuously, that is the basis of the pathogenesis. So the treatment mainly aims at clearing of this A beta through immunological approaches, disrupting the A beta generation through pharmacological agent which will target this secretase, because you know that the main pathology lies in the secretase, in the gamma secretase, right? So this is pretty much, I hope that you have been able to understand this important topic, because this is a long question and this entire process is quite complex along with the morphological features. So I hope that you have been able to gain some knowledge from this video. If you have any personal query, you can mention down in the comment section below. I will meet you very soon in my next video. Till then, take care, keep studying, and thank you for watching.